How does depression affect the brain?
I think again we've gone at length when we've talking about the toll that depression takes on our brain. It's the memories, the nerve cells. There are multiple. It doesn't happen in isolation. There's a correlation and there's a coexistence of a lot of consequences of these brain disorders that cannot be just said as one thing. Like even for that matter, COVID and today, as you were rightly saying, that there's eye twitching, which we never thought. Initially we thought cough, cold, fever, and now we know that okay, rashes, eye twitching, so many more symptoms, loss of taste, all of these symptoms are also coming up. And in the same way, I think depression also has such a magnitude of effect on the human body that uh, yes, there is a list that of implications that are there, obviously affecting on memory and on our weight, about cognitive functions, about concentration, about attention. But I think the list can be over expanded at any point in time, to understand how depression is affecting our brain, because with the new technology that's going to be coming up, with the new kind of scanning that's coming up, we're seeing more and more changes. We're seeing more and more growth into understanding how depression itself is evolving and how it's taking a toll not only on our brains but our entire bodies for that matter.
Correct. Absolutely right again. You are a great fun for narrating anecdotes. I'll also narrate an anecdote here. Let's say I have a very fancy car. I have a Ferrari or I have a Lamborghini or something. How does that car run? There's automatic shift. You put it into drive. You press the accelerator. The car moves forward. When I want to stop it, I press the brake, and the car stops. In depression, what is happening is that I may have the fanciest brain that anyone has ever had, but depression means trying to drive the car with one foot already on the brake.
Mhm.
Essentially, it is a slowing down of all the functions inside the brain. Now, it can be explained in the context of the neuronal damage that you spoke about. There are other cells which could be damaged. There are a lot of electrical circuits inside the brain which could be damaged. But the relationship is that of cause and effect. The problems in all these things cause the depression, and depression in turn will make these things worse until the treatment starts and you put a halt on the depression, which means you help the person to lift the foot off the brake.
Of the bed, yes. I think in all these brain disorders, there is such a creation of vicious cycle. The symptom leading to a consequence, the leading to a disorder, then the disorder itself leading to a symptom, and then a consequence. It's a vicious cycle that has to be broken if proper treatment, is employed.